tarde. Bom tarde. Welcome to Hinde kinang na Florin Talk. Nós tem episode number 4. Nós está very excited de ter dia mais kinang jamar 6 horas da tarde nos usual hour, presented by Monarch CPA LLC, naturalmente ribe plataforma de Sopi Mix Studio. Nós temos outro exciting guest que nos vai introduzir aqui rato com par de tópico ng hobby interessante para tour entrepreneurs. Pero por mim que sei, me vai apresentar meu team que está como presente, naturalmente me tem mi co-host Jennifer com vai.
Boa tarde, conta.
Você bom, Cubo?
Sim, tudo está ok.
Alright, tremendo. Nós temos outro prazer também de introduzir nosso podcast em training. Tem par de tempo eigenlijk tu dia tu viaja conosco. Para que está officially forma parte de nosso panel, nós estamos very excited para say. Arlen, boa tarde.
Boa tarde, como é?
Ready for this challenge?
Yes.
I know you are. Alright, let's kick it. E naturalmente nós temos nosso guest de ave tarde, que está Jeff Feliciano. Jeff está owner, founder de Spia, pero segundo nós também damos a oportunidade para explicar exatamente não somente Spia, pero full su ervaring. Spia naturalmente está psychological office, se me ponho a assim, né? Ele vai repartir descrever sua experiência com hobby único e naturalmente nós vai com essa aplicar para o mundo de entrepreneurs and business. So this should be interesting. Jeff, welcome.
Boa tarde. Thank you for having me.
No, the pleasure is all ours. Vai também show de que combinar pouco de papiamento, pouco de inglês.
Me lo porba, seguro que sim.
Alright, tremendo. Jeff, welcome, biamas. Conta-nos, me te querer prometo que tu tocos. Conta-nos de quem é Jeff Feliciano.
Well, mim, Mr. Jeff Feliciano, pero makumsa no ormitao ta chigida malanta burondi mundo, malanta na Oman, Qatar, Brunei, mi mabay na Amerika pa kumsa kum estudy nang. Makumsa na Pittsburgh, shout out of course at the beginning.
Represent
Always. E makumsa kum mi bachelor's degree na St. Vincent College, então mas um bachelor's de psychology, bachelor of science. Então também tá mi senior year 2011, mahasi mi primeira publication, riba trauma ding mucho nang ding Israeli Palestine.
Okay.
Depois me passa ano na Des Moines trabajando com gente não que viva dentro su casa, pero tem seu problema com saúde mental, não sabe como para fazer budget, não sabe como para viva independente. Então me vai com just passinho não como para fazer poucos mais independente. Então depois me vai na Philadelphia para fazer master's degree in counseling psychology. Pero também me faço outro master's degree in international peace and conflict resolution. Isso aqui que me vai, por exemplo, my focus in post-conflict reconstruction. We estava na North Ireland, Ukraine, Rwanda, para eu da gente trabalhar comunidade depois de desastre, genocide, exile de Crimean Tatars na Ucrânia, e na Northern Ireland, Catholics versus Protestants.
Okay. Very interesting. Nos hoje pergunta para Jeff Caba. Dus, conta-nos toch, não sei, papi, over die diferentes tips, diferentes pontos, obviously, nossa cabeça ali é mental month awareness, pero me te quero toch interessante para conta-nos toch tipo experience, dus por mim como a escola, dus obviously, não está na Aruba, é diferente caminho, dus if you don't mind elaborate, por eu full ervaring e com bingo ba bibat na tudo diferente caminho, né?
É door comitata te traga com IT. Ele estuda na Colômbia, ele vem trabalhar na Lago, e depois ele decidiu para ir a fora de Aruba, ele começou na Qatar, Mi tawta nas in America, pero maping like ding 12 mam. In the time it took for me to be born to get my passport, I was already on the flight to Qatar.
All right.
Depois my Brunei, kinang 8 anos, mi romang tawta born inang. Mabay na Oman después, y después de Qatar. Y for the Qatar, tawta, it's a bit of a funny story because they told me that there were some issues with the school. I wasn't sure if I would have to repeat a year or I'd be set aside or set forward a year.
Okay.
And so we're like, okay, well, should we go to America? Should we not? I don't know. I think I learned maybe a month and a half. They were like, oh yeah, you're gonna go to the U.S. Like, what? Okay, what about my girlfriend? What about my band? What about my friends? And it's like, oh no, you're just send an email. Like, so I just showed up in the U.S. one day and disappeared from Qatar. After people who were my friends at school had no idea where I went. But he made the most of it. I was working for a couple out in Pittsburgh doing construction. They were looking after me, making sure I, had a roof over my head, feeding me at their expense. Probably their worst decision they ever made because I'm not small.
But that was before you finished high school.
Yeah, that was. I moved to the U.S. when I was 16. I think 15 or 16.
Oh, okay. All right. So then you went to the States, you finished high school, and then obviously you continued with your college studies, like you discussed previously.
Yeah, I went to college at 17. I did my senior year of high school and my freshman year of college at the same time.
Okay. And did you know right away psychology?
When I went from Qatar to the U.S., I wanted to do chemical engineering because in Qatar, that's all you see, engineers. But I decided, you know what, I want to do something medical, but medical school in the U.S., it's like $200,000, $50,000 a year.
Peanut, right? Peanut change.
Yeah, no big deal. And so I decided, you know what, I want to do psychology. Psychology seems interesting. So I kind of like, oh, well, let's try it out. And the more classes I took, the more experience I got, the more I fell in love with it. And now it's at the point, and I even tell this to my patients, that if I could go back in time, knowing what I know now, I'd still be a psychologist.
Huh. So unknowingly, it became your passion.
Exactly.
I like to use the word passion. Hobby biading different discussion com nos cinco que entrepreneurs nan com startups nan com nos tava ting essa ita coisa que bem hobby de lanti. Of het hobby de lanti. In mijn caso também pas sobre da PC companhia Monarch bijvoorbeeld existie. PC nos ting alle zouden nos ting 3 hende ook die passion para podcast também. Dus
Você vê a passion para uma porcinha passion.
No. Either you have it or not.
But you can learn theory, you can learn from book, but the drive and that motivation, you can polish it, but there has to be something there before, and that's, I think, the passion that you're talking about.
Right.
Anto Jeff, Kiko aponevo fell in love with psychology. Man, you the hand they work outcome dinang of Kiko thing.
I think helping people was the reason I got drawn to just the medical field in general. And I've been working as a firefighter. I was working on ambulance. I was working in RIA. I was doing all kinds of experience, and I just loved it. And at one point, my dad told me it's amazing that you can help people without even touching them, or that you can heal people without touching them. And I was like, wow, this is real stuff. And so that's when I really started to push and not just be content with just being a therapist or being a psychologist, but really understanding psychology on that much deeper level. And it's an immense field. You'll never stop learning. And so for me, that's also one of the big attractions for it. The psychology that I learned in grad school in 2014, 2015 is not the psychology I'm practicing today. I had to keep updating my treatment plans. I have to update my treatment styles. I have to use interventions that don't work and use new interventions that are being researched. And to stay on top of the field, you have to keep learning. For my license, you have to do 40 hours every 2 years. Mm-hmm. If you don't, they don't give you a license renewal. Mm-hmm. So you're required by the state to continue learning.
That is quite interesting. So obviously, we're gonna jump a little bit, but we're gonna go back. But you still have your license from the States as you're working here in Aruba.
Yeah, and it's I'm licensed through the state of Pennsylvania, and so I'm a licensed professional counselor out there. Master's level counselors out there are called psychologists here, because in the Dutch system, if you have a master's degree, you get the title of psychologist. Mm-hmm. In the U.S., you can only use psychologist if you're licensed at a doctoral level.
Which you are. You're not.
No, I'm not at the PhD level.
Oh, okay.
So in the US,
You're the masters.
yeah, so in the US,
Dus
I'm
na Aruba, but the Kiko Yori, the Dutch system.
psycholoog.
Okay.
Yeah. But if I'm in the US, I can't use that title, but here I can because we're under the Dutch and Aruban system here.
Okay.
But all other
Sabi
psychologists,
siya algo no.
Sim.
but all the other psychologists in Aruba Segumi are all also master's level. So
Okay.
I think there might be a couple of clinicpsycholoog, which is like the next level, but I think there's maybe two.
E Kiko é diferença também. Obviously that you're a doctor.
Yeah, so you have the basispsycholoog, which is you have your master's degree. En después has je een opleiding bij gezondheidszorgpsycholoog. It's like the GZ-psycholoog. GZ-psycholoog is the master's level licensure in Netherlands.
Okay.
And then después die job has je mas opleiding bij de 4 5 jaar, bij je een punto klinisch psycholoog.
Okay.
And those terms are protected.
Okay.
So you can't no puedo llamar por un GZ-psycholoog sin license, but no puedo llamar por un klinisch psycholoog of een clinical psychologist.
Okay.
Unless you get to that level.
Okay. Dus moet in school, right? Para para school.
Thankfully.
Pero después de que school, so para que también shing in school, de com diferentes degrees nang, which obviously também da bisa como sa com hobby but para a passion. Después vai começar a trabalhar.
Yeah.
Right?
So I started with my internship I started working honestly in my bachelor's degree program, and so I started that in 2010. So I've been working.
Okay.
I'm 31 years old with 10 years of experience.
You're 31. Okay. Right. Usually hobby pianos também que não nos gusta papel de idade. Para não está lá.
So yeah, I'll set the tone for you guys. But I started working in a runaway shelter for teens. So kids that weren't in safe homes and they didn't have anywhere to go, they could come there after school and they would have programs, they'd have places to stay, warm food, bed, all that stuff. From there, I worked, like I said, in the teaching independent living skills in Iowa.
Okay.
Then I was a neurocognitive specialist, which is I specialize in treating people who had brain injuries, helping them get back to a normal life. After that, I think I was waiting tables for a little bit, and then I made it to working an internship on a FOC team, which is essentially you work with the patients that no one else wants to work with, like the really difficult.
What did you just call it?
FOCT, F-A-C-T.
Oh, okay. Just checking.
No, that one didn't get past the censors. No, but it's the OCT.
Definitely not.
The OCT is the assertive community treatment team, and the F is usually forensic assertive community treatment.
Okay.
And so we work with homeless drug addicts, people coming out of prison, people with severe unmedicated illnesses, like the heavier folks. And then that was what I did. And I went to DC. I worked as a substance abuse specialist on a team in Washington DC. So we're only working in forensics. So I was in court. I was in prison, doing like the heavy therapy, helping people get back in their community, get them to halfway houses, get them placed. It was a combination of social work and psychologists. So I would do therapy, but I'd also do kind of case management, like helping them get set up with welfare, helping them get set up with housing or groups and stuff like that. So you're kind of controlling the best way I heard it put. The best way I heard it put is that social workers change the environment to meet the needs of the individual. Psychologists change the individual to meet the needs of the environment.
Huh. Okay, that's deep.
I told you I've been practicing this, man.
Yeah. I hear you, man. You're on it. Pero ahora é interessante, porque na América mesmo,
Não tão sei qual.
bom, ela hace diferente tipo de
Sim.
psychology services,
Work.
right? Psychology work.
Oh yeah, we're only in year 5 now. So like I think we in those kinds of works you do all kinds of stuff.
Right.
You're in
Pero tu gente
rehab,
pensa
hospital.
na Aruba, right? But tu pensa que o psychology tá custo.
Yeah.
No, that's
You think
again,
it's
é tabu, é pensamento.
It's that private practice for like if I was working on acting and you saw my patients, like that's the the homeless people on the street that are like talking to themselves that are high, like those were my patients. That's what you would expect from a psychologist. But then when I was working, I used to do
Bom,
alcohol.
na Aruba se combina um tique diferente, mas na Aruba hoi biaba tu pensa que não, but tinha que dizer lo qual what you're doing right now. Después assim, me mesti gente pa I don't know, I need somebody to talk pa I don't know, você para passar certa coisa em vida of para manter mi focus of para que passa tem trauma, então você mas assistência. This is clinical. Sim, we make clinical or from us,
less
going to the office, pero dentro do caso, Botas otro gona. More in the community. Puro pa die hinderen integra den comunidad.
Precies.
Dus ja, dat is quite interesting. Het doet het in te maken met psychology.
Yep, it all falls under the umbrella. You can do art therapy. You can do
Art therapy?
Yeah, you can even. There's a place, Rancho Loco. They do equine therapy. So with horses and kids that are maybe struggling or kids that have trouble focusing, they have horses and that kind of helps you to kind of connect to an animal. It helps you to be able to express yourself more. There's all kinds of different stuff. Like clinical psychology is just a really small part of psychology, but it's the part that everyone sees on TV and it's the part that
Exacto,
everyone sees.
ese es exactamente el punto. Ok. Dus er aqui ervaring mas, dat ding, pues ainda nos falta como llegar ruba. Dus essa é eigenlijk incorporar full ervaring na Amerika, right?
One more. Yes, I think we finished in Washington D.C. Then I went to Pittsburgh. Shout out again. Worked there on an ACT team, and that's where I got my certification for advanced drug and alcohol counselor. And so I got like really deep into the substance abuse treatment. And then from there is when I got my license. So I have been doing my residency the whole time. You have to do 3,000 hours of supervised therapy and a 4-hour state exam to get that license. And so once I got that license, then I was like, okay, well now I can look at my options for leaving. And my parents sent me propaganda de respaldo. And so I applied, and yeah, that's how I came here.
Okay, all right.
Pero respaldo está ahora man vai respaldo viaja mawakuta hopi holandés, tá?
Yeah, it's a very Dutch system. And indeed, when I was working there, we had 4 adult psychologists. I think we had 3 kinderpsychologen. Out of the adult psychologists, there's only me and this woman originally from Curacao, and we were the only ones who can offer therapy in Papiamento. And I was the only American-trained psychologist.
Okay.
And so it was actually kind of interesting to see the differences between the Dutch way of treatment and the American way of treatment.
Essa é a única coisa que eigenlijk não sabe. Dat ding é mesmo wondering, é mesmo pergunta. Ei, nós temos aí uma lista já estou preparado. Dus sim, it's interesting. So, portável we doen ons een mais de highlight. Ei, dus echt, treatment is if there's any difference.
Yeah, and there is, this all talks about individual style. So like, I had a colleague of mine and his style, we saw ourselves as, we would always joke that, you're the better psychologist. He's like, no, you're the better psychologist. And we would go back and forth, but we really respected each other and we could both, work with our respective populations. I felt that the Dutch system is a lot more rigorous in terms of assessment and in terms of procedure and structure. So generally when you give someone therapy, you have a plan for like session 1, session 2, session 3 for the whole treatment plan. The Dutch, in my opinion, can stick very much to this structure, and they kind of use that to keep the patient or keep the client like in the motion of therapy. My style, which is a little bit more American, is a lot more free-flowing. It's a lot more eclectic. So if I have someone, I don't just stick to a cognitive behavioral program or a schema program. I kind of mix what I feel the patient needs to customize their own treatment plans.
You're a little bit more flexible.
Yeah, exactly.
Depending on situation.
Yeah, and of course there are for patients that style doesn't really work for, and I have to get much more structured. And there are some patients that I have to get more kind of free flow. But I really want to emphasize that there's no system that's better than the other. I want to make that really, really clear, because otherwise I'm going to get a lot of angry emails. But no,
it's just different.
It is.
Exactly. It's not better.
Exactly. And
right?
Yeah, and so like we have our strengths and we have our styles, and we do whatever strengths kind of fit our style of therapy.
Percibo bom mês avisa também que dingen aanjagen bot diferente metoden nang ta cambia door ku cierto op informação te bing dilante. Bom, maybe the psychology to field mais grande, and it's still a lot of unknowns.
Exactly.
So ainda não está de processo se vou corrigir se me derrubes that we're still learning.
No, absolutely. And that's what you can be part of this growing field, and if you really get even to the height of the field in some areas, you can really start to make a difference in how this treatment is conducted. Whether it's EMDR therapy, whether it's schema therapy, or whatever path you choose to go down, if you go far enough, you can actually make a difference in how the therapy is conducted, and you can leave your mark on history and psychology, one can say.
Okay.
So you can really grow with the field, and yeah, if you don't.
So you're planning to do that?
one step at a time.
Okay, all right.
I've got a few certifications, and I'm not stopping now. So.
Okay, good. Nice to hear.
Eigenlijk me quero perguntar Jeff pergunta over the experiences para sobre uma que Jeff deal mane correndo na erkuta posa de mental illness basta heavy como bota stay in line posa pa tende tu de caso na erg anto posa bota focus riba emotional mane focus on to stabil.
Yeah, I think there's two answers to that, and I think the first one is that you have to have really good self-care. Like we preach self-care, we preach, self-love, taking care of yourself, doing things for yourself, but psychologists, we have to be on point, especially a trauma psychologist. A lot of times, trauma psychologists will be doing trauma for clinical work, and then after a certain time, we'll just stop because it gets too much, and you just can't do it anymore. But for me, was when I was working in Rwanda, and I heard the stories of the survivors from the genocide there. People being hacked with garden tools, people like little children trying to, save their parents and stuff. Once you hear those kinds of stories, it's like, there's not much that can really push you further than that. There have been some times that I've been traumatized in my own career, and I had to seek my own therapy for it. And so we're not immune. So.
Right.
I'm trying to break the stigma as well, but I know I had to do my own therapy for the traumas that I experienced. And also, I still have someone that I can talk to in the U.S. to keep me on track or just kind of keep me going, and it helps a lot in me being able to deliver what I need to deliver because I'm listening to people all day. So it's nice to have someone just listen to me. Exactly.
Well, actually, when I started preparando the show, right, we were discussing that point, right? It's a very, very valid question. It's an intake, and to put it different economy. And toevallig so een post algoritme op Facebook on we pero Jeff está taking care of himself. Dus het interessante que eu mencionei agora aqui que você tem certo coisa que o meta hace também para stay grounded.
Yeah, and I'm still learning. It's a journey because for example, today was my vacation. I still saw somebody like an emergency patient. I'm not supposed to see people on my vacations, but I know that I can't. If someone really needs the help, I just can't stay away. And maybe that's my own boundaries, but that's who I am.
Right.
And so then from there I can say, okay, you saw a patient today, now you have to do something to put the balance back on the other side.
Is powerlifting part of the self-care?
Powerlifting is integral to my self-care.
Para mim, o Jeff bem fora Jeff trabalha em outro lugar, para mim, com a nessa companhia.
Matraha com respaldo aqui na Aruba.
Okay.
Me tava dando para 1 ano e meio, 2 anos ou algo. E I think one of the things on the thing is why did I choose to start my own business? Like what took me from this.
En naam is onder Atlantica that leading to.
And honestly, me sinto me mesmo me da ding kaha. Me da vai por hey, why don't we do this initiative? Or I see there's a gap in treatment here, or this is a way that we can optimize our systems and optimize our own treatment. And the response I got from a lot of different people were, just send an email or get on it, and then nothing would ever happen. And Respaldo is trying to care for the entire island. They're the main psychiatric institution on the island.
And that's a big commitment, right?
Exactly. And
because obviously, if you see the different articles that they've been floating around in the last few, I want to say weeks and days, that they're not getting enough funding, lack of personnel and whatnot. Well, obviously it is an issue. We were just talking about, May was Mental Month, health awareness. So we know what happened. What was it? Beginning of the month. Those cases. So I mean, they have a lot of people or a lot of a lot of attention is needed for those types of requirements, and so I can imagine it's not easy for them.
Yeah, and even when I was there, you hear a lot about the wait list that they had at Respaldo, and I've seen it from the inside, and we were grinding, we were really trying, and we were doing the best that we could, but it still wasn't enough. We just didn't have the personnel we needed, and so
is it personnel mostly?
I think it's. We only have, I think, at the time I was there, I think we only had 7 or 8 psychiatrists and, like I said, 4 adult psychologists. And, for 800, 900,000 people coming in, there's only so much that you can manage. And so I see their scope, they're trying to treat the whole island, and I'm trying to say, well, what about this, and what about the police, what about, people on the street, what about these other programs, these other rehabs, and the desire was there that they wanted to help, but I think the hands were just too full.
Yeah.
And in hindsight, I can say, they were doing what they wanted to do, and I think that they're still helping, but it's not what I wanted to do.
Yeah.
And so that's where that split happened, that I decided that it wasn't really for me anymore, and then I was able to open my own business. Wouldn't recommend doing it in the middle of a pandemic, but...
No, that's fair. I mean, obviously we nog staan hobby open ginang. Dus dat is interessante papapi over die cijfers over zij. Een discussie zo tinko ku credits. Si man passar, right?
Sim.
Ku nada papi over die was hij negotiation en ku dat habri. Si het surprising of no ku bolo hasie. Of ku people net e ora ta haya a desire of a need pa habri negoci. So it's interesting ku buta trese e punto e dilanti. And why do you say that? Because sobre
I mean, like, it's just, you're in a time period where your source of income is really guaranteed. And, people don't have the money to pay for a psychologist. People don't have the money to pay for a psychologist even outside of a pandemic. And so it was a big risk. And so, yeah, I was paying myself the equivalent of the U.S. minimum wage for a little bit, but then from there you grow, and you just grind. You just never stop working. And then you get to a point where finally you can start to slow down, you can take a little bit of a break. But yeah, I think that it was scary because I was just like, okay, well, I don't know if next month these patients are going to come, or we have a very high cancellation rate among like psychological clinics. Like a lot of times when people make appointments, a lot of time you could expect like 30% of them to just not show up or cancel or move. You ever been in a doctor's office and you see there's like 20 people scheduled at the same time and it takes forever to get to you? That's why. Because in the medical field, there's never a guarantee that people are actually going to show up to their appointments, even though it's for them. And so for doctors' offices, they try to offset that by scheduling multiple people at the same time. Not sure how it is in Aruba, but I know in the U.S. it's very much like that, and people have complained about it before.
Okay.
Pero com essa passa mané de lanta Jeff su proprio negócio, dus vai começar a pensar não, me tem new ideas, new ways de sim a gente com psychology tanto, badis lá tanto, vai bisa me quer me negócio, vai pensar para par de luna ou coisa vai.
Once I left, I was like, you know what, like, let's do it. And so,
so you left before you you had something.
Yeah. No, like when I say risky, I mean risky. No? So
don't worry, you're not the only one. I can attest to that.
But I feel like this may be kind of bad, but like when you're doing when you have an assignment due and you're doing it like crazy the night before, but you do a really good job, it's like that kind of like desperation and motivation, like that will really push you to get it together.
Right.
And so, I mean, I think it took me about 3 months to get the VBA through. And then I had already my first patient by the end of I got the VBA end of April, got my first couple of patients end of May, and then started to pick up in June, and it just grew exponentially. I went from 3 patients to 7 to 11 to 15 to 20. Now I think I'm around 55 patients.
Wow. And you started last year. Dus hij pas April.
Yeah.
So it hey, I think you just 1 year anniversary just happened then.
Yep.
Congrats.
Made it.
You made it the first year.
Yeah, it was a tough year, but I mean, even with all the struggles and even with everything, it's still the most satisfying I've ever been in the field.
Okay, dus bij die jongen aan je, how do you feel?
I feel like there's so much more that I want to do. Like I'm excited. I'm a little bit terrified, but now that my funding stream is a little bit more consistent, and I feel like okay, I'm a little bit more comfortable. I'm a little bit more stable. Now I can really start to push different programs. Like I have this big mental health first aid program that I'm pushing here. So
we saw that, right?
Yes, on Instagram, right?
Yeah, I put I think the same day that the tragedy with the gentleman at the hotel happened, I put a post for press release, and I didn't even have to sponsor it. It got shared by Tele Aruba. I think within 3 days I had 40,000 engagements. And
wow.
People wanted to learn, and it's just a way of teaching people, okay, how do I respond to mental, like this is the same way you learn CPR or first aid, but it's the mental health version.
Exactly, right.
And that's going to be rolling out next month. I already have people signed up. I think I would say like 150, 200 people for the first round. And so from there, we're just going to keep going, keep growing.
Ora como wa que pro bia, me chama wow. E não nada, given it's como isso, it just makes sense.
Yeah.
You know, pas sobre betingo take care di body bijvoorbeeld. Betingo kos pro betingo take care di mental plan di hobby bia in companhia não só compartilhar com ele.
Eta para employers também, vou querer também.
Where do we sign up, Jeff?
Well,
But I mean, you know, it's a good joke, right? But she's right.
No, but like a lot of like I don't really know if I can release information about who signed up for it so far. But like big companies, big hotels, government agencies, a lot of people, schools, a lot of places have signed up to get the training not only for the employees but the managers as well. And so the higher ups are getting the training, and it's going to be like that kind of. Everyone is going to get trained, and like I said in the post, like everyone that asks for help or asks for the training will receive it, and that's my goal.
Pero training é free com a empresa não tá.
The price?
Sim.
It's free.
It's free.
Mhm.
Wow.
I'm looking for corporate sponsors to be able to help me fund, because I want to create textbooks or create things that I can give to people.
Yeah, like see.
So they can walk away with something, and they can actually refer to it and continuously kind of refresh themselves.
Het accorda-me dus orko wat hij you, right? But by the different parents classes nang gekon, but pamphlets nang and booklets that gives you all the different information about what's that or nase of or everything was grande que putinga asi ora ku what's that se kai of koni. But I actually refer to them a whole lot. So, you know, it's a thing mes on trend
And so then you can actually have something tangible that you can keep from this. I did a couple of trainings of similar type of training when I was in Philadelphia, and I still have the textbooks, and I can still look back and refer to them. And so I want to be able for people to have that. I want to create this like mental health literacy campaign to people to learn how to be able to, not, you know, I can't teach you to be a psychologist in 4 hours. I mean, it took me like 10 years.
Right.
But I can teach you how to respond to someone who's really in need of help, and that's what I was missing. I saw a lot of posts on, you know, if you need help, ask for help. So why are we putting the responsibility on them when they don't know how to access services or what to do, or even what it looks like? So train everyone up from the ground up, and then everyone will be able to kind of pick out. And I think that takes the burden off us as psychologists, because we have like that level one, like the first line of defense, where people know how to listen to you and people know how to respond in that way. And then when people are really struggling, then they can go to the next level, maybe a life coach, maybe a base psycholo. And then if that's still struggling, then they can go up to like psychiatrist, gezep psycholo, or even clinic psycholo. And that's the system they have in the Netherlands as well. And so we can emulate that here by creating that first line of mental health literacy. And that's why I'm offering it for free. It's not just for organizations, it's for, you know, people, you know, maybe I've had people messaging me like, hey, in my family I have a couple of people who are depressed and I don't know what to do, or I want to create, you know, give my son the best chance of being the person that he wants to be through his depression. Like parents, kids, students, all kinds of stuff. All kinds of people are coming into this training, or all are expressing interest. Not just the government, not just the hotels and things like that.
Pero me pensa que está algo basta bom para ahora. Normalmente ora gente tem depression, não tá será no mês. Anto ele tá bom para gente sa compa approach não para ahora. Na nota show et viaja, anto eta diz como te bisa atitude não, quando tá mostra que bo por work e está passando de algo que não tá normal ou algo assim, right?
Yeah, and that's one of the characteristics in depressions is that shame. E vergüenza, pues ora bahai e vergüenza, bueno por porque papi com gente, bueno que ai bom mês para just porque será bom mês a fodi o mundo e dor de ser da hobby difícil para papi ou puntra para ajuda. Então se vou reconhecer os sintomas de depression, vou poder dizer, okay, me saco vou just get assim de mo camber dor gelokt, de mo cama, papi com gente, pero me sa me tá com bot struggling.
Em que momento você sente assim? Você sente tem depression?
Normally when you have kind of like, when you lose the taste to do things that you enjoy doing, when you feel this kind of despair, I think the best way I can put it is that if you have, the opposite of depression isn't happiness, it's hope. So if you feel like things are never going to change, if you feel like you're losing hope, if you feel like you're always going to be in this situation and it's always going to be terrible, it's always going to suck, that's the moment when it's like, okay, I need to take a step back because I might be having depression or depressive symptoms. And you can be depressed without having depression. You can still, if you go through a breakup, if you lose your job or things like that, you can still feel depressed. It's normal. But when you can't get out of that depression, when you can't process it, when it's too painful, then it can linger. And that's when the change happens. And so that's when you need to go, okay, maybe I need to step up from this. Because if you're just depressed for something, listening to a friend or talking to someone can make you feel better. But if you're really in that depressive hole, then that's when you need a little bit of extra help, perhaps from a professional, perhaps from somebody who's dealt with it before. And so that's where the different levels of skill have come in.
Mas claro, nós temos podcast live, dus nós temos sequer comments na pergunta na coa bem dilante. Além de se por mas lança a pergunta para Jeff.
Yes, nós temos uma pergunta aqui na antes da bisa que dá se Jeff a parte de outros psychologists na Aruba, excluding the studio na USA.
Excluding the ones from the USA?
No, excluding dus law school nós dus Cuba studia sem considerar Cuba studia na América.
Okay, so I think the thing that kind of person that sets me apart is that when I started psychology, I told you I started in a teen shelter. I started with people who were in their homes trying to learn how to independently live. They just came out of a mental hospital. They just came out of a really abusive home situation. And so I didn't see psychology from the perspective of a psychologist when I started. I saw it from the patient. I was with them in the psychiatrist's office. I was with them in the welfare office waiting 3 hours to get a piece of paper so that they can get food for the month. I was with them in their panic attacks. I was with them dealing with the police, dealing with all this stuff. I would pick them up from the hospital. Sometimes I took them to the hospital because they were suicidal and they didn't feel safe. I got calls at like 3 or 4 in the morning from people, yeah, I just ran into traffic and I want to kill myself. Like, okay, how was your day? And we'd start de-escalating. And so I saw it from the perspective of the patient before I learned how to be a psychologist. And so in the US system, we don't do as much uplating as in the Dutch system, but we are basically thrown into the street and say, okay,
more practical experience.
Yeah. So the Dutch system does have the practical experience, but the American system is defined by that practical experience. And so it gives you, a much deeper understanding of the system from not just from how you see it, but also how the patient sees it or how the client sees it. And so that kind of experience has given me a lot of compassion and empathy. And I think an example, I had a patient recently, a young kid. He came into session, he refused to talk. He just didn't want to talk at all. I could see he was just locked up. He didn't want to be there. He was uncomfortable. And so I just kind of chatted with him. And then the second session, just chatted a little bit again. Still not talking, giving me one-word answers. I was talking with his mom. Third session, he walked in by himself, and he just unloaded everything. And then talking,
you gotta be patient too.
And talking with the mom, she said that they've been to multiple other psychologists who were like, okay, well, let's do a depressive inventory. Okay, how do you feel depressed? How long have you felt this way? And then he gets the question, he just closes up. And this isn't a critique on the other psychologists because I don't know who they are. I don't know their styles. I don't know what happened. I only know what I've been told by the client.
You know Jeff.
Yeah.
You know you.
Necesita algo que te hace Jeff aparte ahora.
Yeah.
Exactly.
Right.
Exactly.
You listen. You and they said they never took the time to just give him a chance to open up on his own. They would just say, he's not answering the questions. I can't help you if you can't talk. So I was like, no, I got to create an environment. I showed him my Twitch stream, so he saw me streaming video games for a while. He can kind of get an idea of who I am without having to be in session. And then, he walked in on his own. And that, to me, I was like, hey, man, I really appreciate that. That's awesome. And then he just started opening up. And it was incredible. It was a really, really nice feeling. They don't always open up.
Right.
I hate to admit it, but, we can't treat everyone. It's just the way things are. But I was able to reach him just by giving him a couple of sessions to get acclimated. And that's the difference, the compassion. Not to say that the Dutch psychologists don't have it, but to say that I've seen it from a different perspective. And that kind of gives me a little bit more of a deeper understanding to what they may be going through.
Okay, interesting.
Sim, já falei over die training que Jeff quer doen. Kon jij me training aqui aan toe brengen onder de sake?
I'm trying to come up with a name because I'm trying to redesign a system of it, but it's let's say like Erste Hulp therapy or first response therapy. Originally, it was under the mental health first aid. I was planning to give that as the training, but because of the way that it's licensed and because of the way it's provided, it wasn't possible for me to use their name.
Okay.
And so, and I've talked with people who are in like, you know, giving mental health first aid in the Caribbean, and we're all talking together and we're all trying to figure out how to make it work. Because the mental health first aid is about more training a lot of people or training more managers and organizations, whereas I want to go into the streets. That's my style.
Right.
Go into the streets and go into communities and really just teach everyone who will be willing to listen to me. If I have to stand in the middle of in San Nicolas with a megaphone to teach, I'll do it.
So that's your part again, right?
Like I said, if I could do it all over again, I'd still be a psychologist. Maybe a PhD, but I'd still be doing what I do right now. Hopefully on this podcast as well.
Okay, interesting. Now, let's talk a little bit about...
Spia.
Yes.
Yes. So Jeff se negociamos spia, então nós queremos contra Jeff para quem spia tá.
Spia tá para toda gente que pide para ajuda. It's, you know, we're starting off as a private practice. We're providing individual therapy. We're providing workshops. We hope to eventually be providing group therapy sessions. That might come, I think that's going to be a 2022 thing. But one of the things that I have in my mission and on my website, which is spiaoruba.com, is that it's my goal to make mental health care accessible for everyone.
Yeah.
And so, how I see
Essa aí tem coisa que tá barrier.
Yeah.
Para roupa gente.
Yeah.
Para roupa biana, mas que vai, pero it's kind of expensive. Don't think caro, dus com tour gente po yega nang. So it's interesting that you bring that forward.
Yeah, and so one of the questions that I get a lot of the times, and I'm sure you guys are also going to get, what's the price of a session? Price is 150 Florin per session. It can vary depending on if it's an EMDR session, because it's an hour and a half, it might be a little bit more, but it's usually around 150. But what I try to do, because I have to pay my mortgage, I have to pay my bills, I have to eat as well. I'm not being a millionaire doing what I'm doing, but I have to support myself, and I have to respect the time and the energy that I've put into my profession.
Well, the studies, right? I mean, you did the 10 years of education.
Mm-hmm. Yeah, so the 7 years of education and
Or
3 years of residency. So it's 10 years of learning, just to get to the point where I can sit across from someone and give therapy.
Right.
But what I try to do is I have a certain number of spots in my caseload. So let's say for example, if I have a caseload of 55 people, I'll have 10 spots where for people with low income or people who can't really afford therapy. And then we put the price, we kind of negotiate what's the best price. I was treating a young woman really sick. She had a lot of mental issues and she was really struggling. I think she was seeing me for 45 Florin for 30 minutes.
Mm-hmm.
But I can't give the price to everyone, and if the spots fill up, and I'm sorry, the spots have filled up, but that's kind of the way that I'm starting to do this, along with advocating for a systemic change, not only in the government, but in the law to AZV to start covering
more of these
mental
sessions.
health. Yeah.
More of these.
Because AZV Plus will cover you for, I think they'll cover almost 100 Florin of the sessions. Private insurance companies like Citizens of Nagico, if depending on your policy, they can cover it. If you work at a hotel, your policy might cover mental health therapy. But if you just have AZV on its own, it can't. There's no coverage there for the mental health part, which is, in my opinion, quite tragic. There should be something, because otherwise you're creating like a gatekeeper effect where only certain people of certain income levels can even begin to afford therapy.
Tenho outra pergunta para Jeff. Being a psychologist, I think Jeff somente business com Jeff tá handle isso aí para sobre or but start a business, but stress.
Yeah,
Pues não vai bom, pero
You're not a psychologist anymore. You're a business owner.
Yeah, and so
as well.
Yeah, and that's the part that really they don't really prepare you for. How to fill out the insurance claim forms, how to invoice, how to get people set up with all the administration stuff. As a psychologist, I treat you, I write your treatment plan, I research ways to treat you, and I write notes and do my documentation. And then as a business owner, I got to think about space, I got to think about rent, I got to think about paying my wonderful accounting firm. I don't know, Monarch CPA.
Never heard of it.
But I
payroll, taxes, due by the 15th.
Mm-hmm. Yep. Get your information in, everyone. And I think that all that parts was it was exciting, but it was also terrifying because I didn't know what was the right thing to do. So you just kind of have to. I was fortunate enough that one of the biggest problems I had with opening a business or with working in different places in the past was that the software we used was always trash. It was always like the cheap. I'm sorry. It was always
honesty.
It was always
but this is an open, this is an honest show as well. Bisa nos maneketa.
Hey man, you talk to any of my colleagues who worked with me back then, they'll agree. But like, the software was not optimized for what we needed it to be. So we're using like private practice software for a hospital systems intervention. We're using software that's designed for big hospitals to be worked on a very small team, and so it wasn't what we needed it to be. So the first thing I did was research all the private practice softwares, and I found a really good one, Theranest, and it really streamlined everything for me. So that took a lot of the guesswork out. Does the automatic invoicing, the billing, all the details.
Right.
I can create statements. I can create invoices. You can do all kinds of stuff with it, and manage your practice on both sides. And so.
But that's an interesting point because, yeah, we're applying it to your field of service, but esta conta eigenlijk para toda gente, ¿no? Dus qualquer gente que está começando negócio ou que depende de tipo de trabalho que pode fazer, ou depende de serviço ou produto que pode vender, na final do dia, porque se pode vender produto, point of sale, ou se pode serviço, colocar software que pode fazer parte de sales, administration, mais fácil possível, porque everything dollar cabeça menos.
Yeah, and like I had to invest in that software. I also had to invest in scheduling software. I had to invest in the website, and in my feeling, I think that's really important to set yourself up for success. And like, don't just try to do it on Excel. Just don't try to do it the easy way. Like,
No.
If you're serious,
I love Excel, but not for your administration and running business. I don't tip para todos nos oyentes nang. Se nos ayuda naturalmente por aquí en contact, pero Excel is Excel is like a very powerful tool.
Yeah.
I love it, but these knows is a pabo administration of pabo core business.
Yeah, and so I think it's, like I said, very important. Like I set myself up the best that I could, and then the rest of it was just learning as you go. Which it was like my residency. You know, you sink or swim. They put you in an agency. You get a job, and you start gathering your hours, and you figure it out or you don't. And so that kind of prepared me for jumping into that business.
¿Y con Jeff llegan a EPOS y research?
EPOS?
Theranest.
Oh, I did my research. I talked to some of my colleagues. I talked to people who had private practices. I just went to Google and put private practice software and just see what came up. And I did trial periods for, I think, 3 different. I narrowed it down to, this is a good thing to use for Excel. I used Excel to make a list of the ones that I wanted and the pros and cons. And then I narrowed down 3 that I wanted. And I did all a test trial for a month of all of them. And I decided Theranest was the one for me. And I still see there are some gaps then that can be addressed. But I mean, that's really any software. But if I've been really satisfied.
But I like that tip, no? Tip is toch vital. Hoy en día, el mundo de software cambia hobby. Promedio, tengo que investir gran cantidad de placa, tengo que pay upfront. Hoy en día, maioria de diferentes software na kubo ting ta cloud as a service. E caminho da hobby de nang tin trial periods. Yeah, trial period doesn't cost you anything. So, bota por bele, então se está trabalhando, então em verdade, por diferente nang, então kuta fit your need the best, you choose this one of that one. De caso se que nos na metade nos assim par de trial com par de software para nos planning que com aí, yeah. Naturalmente para o acto de pros and cons, price naturalmente sempre um factor, but é só hecho que não tem huge investment upfront, that's a diferença, so okay, pick and choose a little bit. So that's a very interesting tip.
And também que pode stop anytime.
Pode stop anytime. Maioria de não stop anytime, correctamente.
Yeah. You just have to make sure that you actually go to stop and they don't charge your card for the next month.
Yes.
No, true.
Stop the payment. Jeff, nos quer combine um tiki de psychologist com business. So, nos podcast de entrepreneurship. So, mas article que tá combina essay, então nos quer hire tips de Jeff conhece também, só nós também somos em headline, então Jeff por visa mané que o Jeff tá pensa over it,
Okay.
right? Dus mental approach, como handle haya razonan of kunan ta comienza un business of na nota by pay, con na mester preparando mes.
I think the short answer is that you're never really ready to open your own business. You know, you're never going to have everything in line.
So it became a depend.
No, I mean, like the thing is it's if you want to be able to get your basic funding set up. Like in my case, like I had to get the funds to get the VBA. I had to have the funds to get the software I needed, and I had to have some kind of startup just to kind of keep me going. But whether I was like, I don't know if I'm ready. Am I qualified? Can I do this? I was like, well, my license.
Because I think a lot of people think about it when they start a business.
Mm-hmm.
So as a psychologist, what are the considerations that, or any tips that you can, bring forward?
I think the biggest tip I can give is having a support system. So if you can if you have people around you that can kind of identify and can be real with you about your skill set, if you have colleagues that you can talk. And for me, when I started, I was like, I don't know if I can do this. Like, am I really qualified? I talked to a couple of colleagues and it was like, yes, you are qualified. Why are we even having this discussion? Like, you've been working for 10 years in the field. You have a license. You have 2 masters. You can do this.
Yeah.
And then through that, I realized, okay, I can do this, but there are some gaps in my knowledge. So should I wait to do all the training I need to do before I get to start the business, or should I start the business and then get my training ongoing? And then I decided to start the business, get my training ongoing. And as it turns out, all of the training in psychology requires you to practice on patients. And so you can't have, if you don't have a business, you don't have patients, then you can't get trained. And so it's designed to be that ongoing, on the ground process. And so, but without talking to my colleagues, without talking to people who were there to support me and to listen to me when things got too tough, or to kind of have my back when I was dealing with rough times, I think that's what really helped me to kind of take that step to get it done.
Que tips ng Jeff for young entrepreneurs, young professionals nang already hebben na negosyo kung to deal with stress, anxieties?
It's a normal response to an abnormal situation. Running a business and starting stuff, if you're anxious about where your funding stream is going to come from, if you're anxious about getting clients or getting traffic or how are you going to market, having that anxiety is normal. And knowing that you're not alone. Talk to other business owners, talk to other people who are going through this. Look for someone who can not necessarily mentor you, but find someone like, hey, you know what, I just want to pick your brain about something, or I have a question about this, or how did you deal with this? What I'm doing right now, I'm streaming on Twitch, and I reached out to another big streamer who is also a psychologist, and he does the same kind of work that I want to do. And I was like, hey, I don't want to take too much of your time, but I'm doing this channel. I want to do the same kind of thing you do. What are your recommendations for staying within my ethics as I'm doing this? And he responded back, and he's giving me all kinds of advice. He's supporting me. He's promoting my channel as well. He's like, I follow him on the streams, and he'll point me out and things like that. And so he's supporting me to grow my Twitch stream. In the same way with my business, I talked to a lot of business owners. I talked to people who had started their companies in the U.S. I talked to people who had started businesses here to get an idea of, okay, what do I need to be aware of, and what are some considerations I need to have? And that's really what made the difference for me. And so when you have anxiety is a fear of the future. When you try to control every possible outcome, that gives you anxiety. So accepting where you are, accepting what you can do, and accepting that you aren't in control of the future, you can focus on what you can do to have as much influence over it as possible through preparation. I think I was reading something that says, a lot of times we feel like we get lucky when we get successful in these businesses and we start to make our way. Luck is a combination of opportunity and preparation. If you're prepared for an opportunity to present itself, then you can take advantage of that. You may see that as luck, but in reality, you're prepared for that moment.
I don't know if it's true or not, but I'm a firm believer in you don't get lucky. You create your luck.
Exactly.
You create your luck through, like you said, opportunities, your experience, your capacity.
Hard work,
no, definitely, but also your mental state in terms of positivity, and it's almost manifesting. I'm
No,
very in today, right?
Ella les hace The Secret, and ella pone, vai hace un successful business.
Exactly. No, but that's a real thing, and I use it in my treatment as well. If you spend all your time thinking about every time you hit a red light, like, oh, it's another red light, like I always hit the red. No, you're only thinking about the red lights. You're not thinking about all the times the green lights let you through. And so you have to create your own luck. There was a whole study I read it in Psychology Today, I think 3 or 4 years ago, that talked about serendipity and luck, and that you do create your own luck depending on your outlook of the world. You can choose to see something as lucky, or you can choose to see something as, oh, well, this is just the way things are. And so your outlook is reality can be what you want it to be, and so your outlook is really going to influence the way that you interpret things around you.
Anto, con Jeff lo advice pa gente kuta start un business pa sobra gente tem viaja ta kita trabalho of nanta invest hobby placa pa deal com rejection. So si business não vai bom, tá fail of
or a setback.
Tem viaja botin aya nan duro. A mim tá pensa um business den 5 aya e tá grow. Si den 5 años no grow, vai. A mí también se sé, pero con gente lo mester deal que sei na maneku e años mais duro que tá para mim años de um business.
Of em meu voorbeeld moet doen, dat moet een negócio que existente op een año do pandemic hit.
Sim.
Right?
Também.
I think. All right, I'm gonna give you a free therapy session advice for that. So, when you have overwhelming feelings of depression, anxiety, trauma, when you feel this rejection or when you experience failure, it's all about how you interpret this about yourself. Did you fail because it was a pandemic and you weren't prepared for it? Was it happen because you're a bad business owner? Did it happen because you're an idiot and you made all these bad decisions?
New gente está preparada para pandemic, by the way.
Exactly. No, but my point is that the only one of these that's true is the pandemic. If you choose to think that, oh man, I made all these mistakes, it's my fault the business failed, it's my fault I got rejected, then you're digging a hole for yourself.
You're creating all this negativity on yourself, right?
Yep. And so when you have these
bad
beliefs,
vibes, whatever you want to call it.
Yeah. Not manifesting things, right?
Right, exactly.
When you have these beliefs about yourself, like I'm not worth it, I'm not good enough, I can't do this, I'm broken. When you have these thoughts, these are what's gonna really mess up your mood and mess up your experiences. And so if you do experience rejection or if you do experience failure, it's important to really take a step back and say, okay, how did this happen? Where did this come from? And from there, you can keep a realistic, rational view of it, and then you can deal with it in a healthy way. For example, with me, when I'm working with the site, when I'm working with patients, I feel like, okay, if I fail or if I have a bad session, it's like, damn, I don't know what I'm doing. I'm a bad psychologist. But because I've been doing this for so long, I'm like, no, it's not that I'm a bad psychologist. It's just that
circumstances or the patient.
It was a bad session.
Yeah.
Bad sessions happen. I'm not perfect.
Everybody's going to have bad days.
Exactly.
Sim.
And so
and you choose how to react.
Yeah. And so if I choose to react that I'm a bad psychologist, that's a lot harder to fix than, you know what, maybe I need to try a new intervention. Maybe I need to try a new approach. Or you stop yourself from actually creating solutions to the problem. Instead, you kind of end up in this pit of despair. And so to deal with rejection and failure, that you're always going to have people that reject you. You're always going to have people that are against you. And just remember that it isn't about you. It's about the environment. And if there are things that are kind of affecting how you're going through this, really check yourself. See if they're real.
Okay. We are running in our last few minutes, but we do have one more question from our oyentes. Is that a word? English popular.
It is
Listeners.
So, kinami tem pergunta que eu te bisa, que colota bom tips para estudante não que quizás sofre de mental health and to quer have na own business while dealing with mental health.
Interesting.
By psychology.
So,
by SPIA.
Come to SPIA, please. Well, but
by cerca Jeff. Pasó la lanta un día, tuve la creé su negocio.
I think the best way is, for example, if I'm doing trauma therapy with someone and I'm helping them treat their PTSD for an assault or something, part of the treatment at the end after we're done processing is like, get involved in a movement, or if you feel comfortable, like integrate, like use this experience as something that's can help other people. So if you're a survivor of rape or if you're a survivor of abuse and you get through it and you are able to get into a safe situation and process everything, we encourage that you use your experiences in a positive way, because that changes them from something negative to something that you can now use to heal other people. Mm-hmm. And so consider what ways your experience of mental health has helped you to get through certain obstacles or overcome a lot of different things. And that's something that you have that not many other people can have. And so you are already at an advantage. So consider in what ways that, yes, you probably have to take care of yourself a little bit extra. You have to be more attuned to what your needs are. But in what ways is this going to be something that's going to support you and help you in ways that other people aren't able to see?
E a mim pensa também, ora vou abrir negócio, vou mente tá hobby ocupar. Então, bambisa, ora gente tem hobby free time, não tá gusta deal com emotions negativos, pensamento negativo. Então, ora bota basic, então bambisa negócio tá bom sonho, bota focus riba sei, bota focus ri meu negócio tá vai dilante, então bota usa energia em não, em vez de pensar tu é coisa negativa que você
chance de pensar coisa
negativo de vida. So, a mim pensa se tá passa bom.
Well, unfortunately, the hour is it is gone, but we have to make our closing statements here. Jeff, por último, importante que tá prudente bo share um par de informação de spia algemeen com op contact spia. Nós apreciamos se um par de psychological tips para entrepreneurs. Na final de Florin Talk, we love this topic, but also we're talking a little bit about business and entrepreneurs. Dus we um par de final statements. Hey, this is your show now.
All right, so if you're interested and if you feel like you need some extra help, contact us. We're spiaaruba.com. We do 30-minute free consultations if you want to see if this is right for you before you get started with therapy. No obligation, no payment, no commitment. We can come and just have a conversation. You can also follow me on Twitch. I'm the Island Psychologist. If you are uncomfortable coming to a therapy session, but you want some advice, come check out my Twitch stream. You can drop your question in the chat and I answer them as I'm playing video games or as I'm doing my office hours. And it's an opportunity to also learn about mental health topics like loneliness, personality disorders, how to keep yourself safe, what's trauma. And we also have a Discord, we have a community, we have all kinds of people that are following me that are here for each other. And so if you just want a community of people who are there to be positive and supportive, check out the Island Psychologist on Twitch. And for entrepreneurs, if you want to start your own business and if you want to really get into this, I can tell you it's the most grinding I've ever done in my life. It's the most difficult thing I've ever done in my life, but it's by far the most rewarding thing I've ever done in my life. And I think that the key that you have to remember is that be true to yourself, be authentic to yourself, and while that may sound a little bit like generic advice, you are your product. You are it. The way that you choose to deliver your services is what's going to differentiate you from the rest of the people who are in your field. And so, try to present yourself authentically. Try to be authentic. Try to be your own person, but be open to learning from others. Figure out who you see in the field, whether it's, in my case, master clinicians or people who do trainings or people who are in the field already and I can learn from them. Figure out who is in your field, try to kind of see what the way that they think and how you can integrate that into your own style. But remember, it always has to be your style. If you see me on Twitch, I'm authentically myself, for better or for worse. If you see me here, I'm authentically myself. And in therapy, I am authentic and I genuinely want to help you. And I hope that if you were to come in therapy with me, that you'll be able to see that. And so just be yourself, be authentic. Don't try to be something that you're not.
Jeff, mi te quiere mi home, no puedo hacer ele. So, nós está very appreciative de wise words, não?
Always a pleasure.
Naturalmente, um prazer de timbo como guest de Florin Talk. Mi te quero nossa touch diferente tópico, não hobby interessante. Não somente é parte de business, pero também é parte de mental health, psychologist, bo ervaring. Como tawaco, não tá somente é parte clinical que hope gente está acostumado com ele, pero que tem será hope mais field mais grande mesmo. This was very interesting. So thank you for being here.
No, it's my pleasure.
Me te seguro in futuro nos lo ting otro follow-up sessions também, if you're open to it.
Hey, always happy to
Seguro que
come
nos
out
lo
to
ting mais
conversations.
tópico que nos por cover, não somente a parte de psychology, mas também a parte de outra informação que é valioso para nos business owners, entrepreneurs, startups, and then existing business and whatever it may be. Me quero agradecer naturalmente a Len que join nos como nos podcast trainee. Estava as expected, nós temos confiança boa, and obviously you shown, mesmo com os co-hosts sempre tá shine no show, não, dus pouco a pouco nós get more comfortable, more at home, so no, me agradecer por tour. Sabe da Florin Talk, episode number 4, acabei de finalizar, dus seguramente esperando que o oyente e podcasters não tem informação valiosa que a bem dilante para você não. Se você tem qualquer pergunta, naturalmente você pode lançar também riba e live feed, se não, você pode mandar riba e Sopi Mix Studio su Facebook page. E me agora por último, que nós temos o resto de schedule, nós temos agora aqui riba Sopi Mix Studio, nós temos 8 horas à noite, nós temos executar. Webor nós temos Unfuckable, esperamos dizer bom. Se dá webor de noite, já são 6 horas, nós temos show novo, que está de respaldo, nós temos pabo, 8 horas de noite, Pelotoc, me escuta do bem. Não, você vai escutar Pelotoc?
No, it'll be my first time tonight.
That's tomorrow night.
First
It's
time
interesting.
tomorrow night.
It's very interesting.
Oh, but I got to catch up on all the other sessions, right?
Yep, you sure do. Já web 6 horas e meia, nós temos Bamba Saúde com René Wills, aí também no show novo que eu comecei a semana, que já estou e meia naturalmente, Original One. Nós vamos começar full e aventura e challenge aqui, Sopi Mix. Já sabe, nós temos 1 hora PM, nós temos Tech Impact e 7 horas da noite, nós temos Rock com Marlon Moore. Dus, naturalmente, agradecendo a tu gente. Otsimang! Portanto, não sei.
I know.
Tu chamar 6 horas da tarde. Thank you.